Good morning, Chairman Kildee, Ranking Member Castle, and members of the subcommittee. Thank you for this opportunity. We believe that improving the education, compensation, and retention of the early childhood workforce is the key to producing positive health and educational outcomes for young children. In 1990, using data from the state's first early childhood workforce study, Child Care Services tested a scholarship model designed to address the low education, poor compensation, and turnover of the workforce. Now operating in 21 states, TEACH scholarships help pay tuition, books and travel costs, and support paid release time to allow teachers to balance the extra load of going to school. As teachers complete the required credit hours, they receive a raise or bonus and must continue teaching in their program for another year. In most TEACH states, teachers, directors, and family child care providers working in child care, Head Start, or pre-K settings are eligible for scholarships. TEACH scholarships always support formal coursework leading to credentials or degrees and require a funding partnership between individuals, their employers, and the TEACH program. In fiscal year 08, states participating in TEACH spent about $28.3 million. The largest source of these funds came from the Child Care and Development Block Grant. Last year, over 21,000 individuals across the country working in over 10,000 different early childhood programs received TEACH Early Childhood scholarships. 10% worked in Head Start programs, and 62% taught 3- and 4-year-olds. About 46% were women of color, typically earning less than $10 an hour. They attended almost 600 different colleges and universities. Together, these scholarship recipients completed about 130,000 credit hours. Their average earnings increased, and they left their classrooms at average rates of less than 8% annually. And this is in a field that routinely experiences 40% turnover a year. While attending a community college, teachers' basic language and math literacy skills improve, as well as their knowledge of cognitive, social, emotional, and physical development. About 2/3 of participants were working on their associate degrees, doing this while working full-time and achieving a 3.25 mean grade point average. In 1994, to address the systemic problems of low wages and high turnover, Child Care Services began the Child Care Wages Project. Graduated supplements are paid directly to participants and tied to their level of education. Supplements are paid every 6 months with funding from Smart Start and CCDBG as long as the individual remains in her classroom. Supplements range from $200 to $6,250 annually. Last year we had almost 9,000 participants. Graduated supplements encourage continuing education. Wages participants with 2- or 4-year degrees had a 14% turnover rate, identical to our K-12 teachers. In many states with either teacher wages programs, there are waiting lists for participation. Other states need funds to get these programs started. Investing in high-quality early care and education is essential for all of our children from birth to 5 if we want to stay competitive in a global economy. Disparate access to quality exists across age groups and for children within states and between states. States struggle to make the right choices, but resources are not adequate. With so many families unable to afford high-quality child care and without the resources to help them, state administrators continually choose between quality and quantity. More funding is needed to ensure a uniform level of quality for all young children. The reauthorization of CCDBG provides us with such an opportunity, and we believe that one area that must be targeted with increased investments is raising the education and compensation of the early childhood workforce. Investments in increased educational opportunities tied to compensation and benefits provide early educators with a viable, sustainable career path in a field in which they will remain committed. TEACH scholarships and wage supplements help the early childhood workforce become better educated, compensated, and consistent as it strives to meet the higher standards associated with pre-kindergarten, Head Start, and quality rating systems. And direct investment in the workforce means that quality can be raised without burdening parents with additional costs. Our work has taught us that the early childhood workforce wants to increase its knowledge and skills through our nation's higher education system. The key is accessibility, having the money, the time, and the support to make it possible. However, it is both unrealistic and unfair to expect the workforce to go back to school while they are working full-time without help and without the promise of better wages and benefits. With sufficient investment in the workforce, we can improve education and retention. North Carolina's turnover rates are down, and the education of the workforce is up. And best of all, the overall quality of early care and education has dramatically improved. When teachers are living on poverty-level wages and barely able to support their families, then leaving the job they love becomes a matter of necessity. Low education, poor compensation, and high turnover are national workforce issues. It is time to address them with a national targeted investment. Thank you.